in Nature. Did it save 1 million lives? Well, there's no data to support that. There may be data, there's no study, there's modeling studies, there's faulty data. I'm not going to sign on to something if I can't do it to a scientific certainty. It doesn't mean that I'm, anti-vax. It just means I'm pro-science.
Thank you. I yield back.
Thank you. Senator Lujan.
Thank you, Mr. Chairman. Secretary Kennedy, Dr. Daskalakis, who recently resigned as director of the National Center for Immunization and Respiratory Diseases, his resignation letter stated he and his team were never allowed to brief you. I'm curious who you're listening to, since it's clear you're not listening to qualified experts like Dr. Daskalakis. Can you give the committee the name of the person?
I don't consider Dr. Daskalakis.
Mr. Secretary, the question that I have for you is, can you give the committee a name of who you're getting briefed by?
I'm getting briefed all the time by CDC.
Just a name.
Well, Dr. William Thompson's one name.
Thank you very much, sir.
Now, but I can get you a whole list of others. It's on my schedule.
Mr. Secretary, that's not a hard question. You know a lot of answers.
I'm not being evasive.
Okay, then you answered it. Let's go on. Now, you said that you're soon going to release a study claiming to reveal the cause of autism, timed unsurprisingly with the upcoming ACIP meeting to justify taking vaccines from Americans. Now, as you know, autism affects millions of children, so I guess you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
He's a contractor?
He's a contractor.
Do you know who works for you, Mr. Kennedy?
Yeah.
Do you know that Mr. Geyer is listed as a HHS on the employee directory as a senior data analyst, not a contractor?
He's a contractor. He's not an SGE.
So is your website wrong?
He's not an SGE. I don't know what
I'm going to pull up the website for you.
He's a contractor.
If the website says he is a senior data analyst, will you at least admit to the committee
Well, I don't
that you
know
were
if
wrong?
a contractor can be classified as a senior data analyst or not.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board, he sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot. It's incredible, Mr. Kennedy.
Senator, you're
incredible,
ridiculous.
sir. So here's the question I have. You brought him in to do this study. I think there's no question about it.
I told you he's not doing a study.
Is he participating in the study?
No.
Is he doing any analysis in regards to this study?
No. What he's doing is getting access to the Vaccine Safety Data Link, which is the biggest repository for vaccine information that your friend would not give us for 7 months. For
Mr.
7 months.
Secretary, let me ask you this question, just because you know the answer. What is Mr. Geyer doing?
He is the only one, because Congress ordered CDC to open up the VSD to him in 2002. He's the only outsider who's ever seen it. So because CDC will not give us, they have
Mr. Secretary, is he participating in this then?
No, he is.
You just said he's the only dude that knows what's going on here.
Do you want me to explain it to you, Senator, or do you just want to show? Do you just want to showboat?
I'll submit this.
You just want to showboat for your ads, or do you want to hear a real answer to your question?
Mr. Secretary, you choose to know answers to questions with some colleagues. And
I'm willing to give you the answer. I'm willing to give you the answer.
Mr. Secretary, someone should have asked you, maybe President Trump should have asked you, are you a trustworthy person? And we should have waited for an answer then. Let's move on.
I don't even know what you're talking about. You're talking gibberish.
Mr. Secretary, let me speak slowly and clearly so that you can understand me through my New Mexico accent.
And then give me a chance to answer.
Does this help? Can you understand me?
Yes.
Appreciate that. Mr. Secretary, yes or no, did you hire Mr. Geyer to do this study?
No.
Mr. Chairman, well, let me ask, maybe we'll just get a good answer here. Mr. Secretary, Will you commit to sharing the protocols used for the autism study with Congress and to the public?
They're public.
Will you commit to giving it to this committee by the end of the week?
No, not because
you commit to
that's
give it-
not the way it works.
Will you
You don't
commit-
even know what you're talking about.
Mr. Secretary, will you commit to sharing the protocols for this study by the end of the month?
We already have
You
put
just said it's
out,
public.
we put out the notice of funding opportunities, and then the scientists from
Let
all
me-
over the world.
You're not understanding me. Let me
No,
speak
you're
clearly
not
again.
understanding how the world works.
Do you understand what the protocols are?
Senator-
Do you understand what they are?
The scientists who are doing the studies submit the protocol.
Okay, so you know
That's
what
not
they are.
coming from
Okay,
us.
So will you commit to sharing those protocols with this committee?
Well, anybody can get a hold of the protocol. It's published with the study.
Mr. Chairman, what I'd like to ask is for your commitment here. I'll send a letter to the secretary. I'll ask for support from the leadership of this committee to ask for those protocols. If those protocols are not given to this
Anybody
committee,
can get the protocols.
Mr. Secretary, I'm not talking to you. Mr. Chairman, what I'm
If the
asking,
protocols are public, we can work with you to.
what I'm
get
asking,
access.
Mr. Chairman, is that if those protocols are not given to this committee, I'm asking for your agreement that we follow through with a subpoena to get them.
No, I will not agree to subpoena anything. Let's see what
But
happens.
Mr. Chairman, you'll help me get them if they're available publicly?
Yes.
I appreciate that, Mr. Chairman. Mr. Kennedy, with all the questions here today, people just want to know the truth. When,
I don't think so.
Mr. Secretary, you don't think so? Thank you.
I don't think so.
I hope everyone recording that got that, because there explains the Secretary's tenure here. Look, 2 young ladies in Las Cruces, New Mexico, at a town hall recently gave me this starfish pin. I was going to give it to you today, but after your questioning today, I don't think you deserve it, because what this represents is to remember that every one of us can make a difference, sir, to something as small as a starfish on a beach that maybe got washed up, you throw it back in the ocean. You might not save them all, but you can save one. I'm sorry that you're not worthy of this nice little pin, sir, as a nice reminder. I'm going to pray for you, Secretary Kennedy. I hope we do better. I want you to do better. But today was a failure for you, man. I yield back.
Senator Warnock.
Thank you, Brother Chair. Less than a month ago, we received the heartbreaking news that a gunman opened fire at the CDC campus in Atlanta, Georgia. This obviously is my neck of the woods. This is heart-wrenching for all Americans, but for those of us especially who live in that area. A DeKalb County police officer, David Rose, was killed. The shots hit buildings on campus in at least 180 places, narrowly missing the CDC's daycare center. Law enforcement recovered nearly 500 shell casings. Clearly, he came to do a lot of damage. It's a miracle, and thanks to the quick action of Metro Atlanta and state law enforcement, more people were not killed. The Georgia Bureau of Investigation announced that prior to the attack, the gunman expressed discontent with the COVID vaccine and, quote, wanted to make the public aware of his distrust of the vaccines. Secretary Kennedy, I assume you are aware of these disturbing reports of the gunman's motives?
Yes.
And, you know, I understand that some people may have concerns about new medical breakthroughs, but those people don't have the world's top medical experts working under them. You've been over HHS for 7 months now. Have you ever been briefed by CDC's career immunization officials to discuss your concerns?
And by the way, every member of this panel has criticized
Sir,
President Trump
I
and
only have
demonized
three.
him.
Have you ever
Are
been
you
briefed?
complicit in the
That's-
assassination attempts on President Trump?
Sir, I'm asking the questions. You are the witness. It's a simple yes or no question. Have you ever been briefed by CDC's career immunization officials to discuss their concerns?
Yes, I have.
What was the answer?
Yes.
You have been briefed by CDC officials, the career immunization officials, to express your.
The
Okay.
senior vaccine safety scientist, for example.
Have you ever been to the CDC as secretary before the shooting on August 8th?
Have I ever been there as secretary?
Have you been
No.
there as secretary before the shooting? Okay. let's return to the shooting and the aftermath. Secretary Kennedy, I'm about to ask you a series of yes or no questions about the events of the past month, and I would appreciate just a yes or no response. You called Dr. Manarez to your office on August 25th for a meeting. Is that correct? Yes or no?
It could be. I just don't know the date. I'd have to check my calendar.
Was Jim O'Neill the man you just appointed as acting director of CDC
Yeah.
in the room on whatever date you met with him, since you can't recall? Was he in the room when you met
Yes.
with Dr. Manarez? In that meeting, did you criticize Dr. Manarez for her statements to CDC following the shooting where she said, quote, misinformation can be dangerous?
I don't believe so. I have no recollection.
You don't believe you criticized her?
Oh, I criticized her.
Did you criticize
Not
her?
for that.
Did you criticize
I don't
her?
know. I don't even.
Did you
I don't know
criticize her
anything
for her
about that
statements
statement.
to CDC workers following the shooting?
Did I what?
Did you demand that she fire career scientists or public experts at the CDC?
Yes.
Did you demand that she accept the recommendations of your hand-picked vaccine advisory panel without further review by career CDC scientists?
No, I did not.
You didn't ask for her commitment ahead of time that she would accept the recommendations from the advisory panel? You're
No,
denying
what
that?
I asked her about is she had made a statement that she was going to not sign on, and I wanted clarification about that.
Did you tell her to accept the advisory panel's recommendations?
I told her I didn't want her to have a rule that she's not going to sign on to it.
Did you say that the CDC was, quote, the most corrupt federal agency in the history of the world?
Not the history of the world, but definitely
Did you
within
say-
HHS.
did you say that?
I did not say that, but I did say it's the most corrupt agency at HHS, and maybe the government.
So you called the CDC corrupt. Did you say that CDC staff are, quote, horrible people?
Horrible people?
Did you say that they're killing children and they don't care?
No.
Okay, I think that we all have a history of listening to you and these answers, but you're on the record for a number of these statements. Despite your lack of credentials and expertise, clearly you have an agenda. It is a threat to the public health of the American people. It's clear that you are carrying out your extremist beliefs, which is why you attempted to fire Dr.
Senator, we're the
Manarez.
sickest people in the
Sir,
world.
I'm not.
We're the sickest people on earth.
I'm speaking.
How am I a threat?
Secretary Kennedy, for the first time, we're seeing deaths from children from measles. We haven't seen that in 2 decades. We're seeing that under your watch. You are a hazard to the health of the American people.
Can I respond to that, Senator?
No, I claim back my time.
We need to wrap
You are
up.
a hazard to the health of the American people. I think that you ought to resign. And if you don't resign, the President of the United States, who put forward Operation Warp Speed, which worked, should fire you. Thank you so much.
Senator Welch.
Mr. Chairman, thank you. I want to sum up, and I want to make 3 points. First, we have a healthcare affordability crisis in this country. And second, Secretary Kennedy's policies is making that affordability crisis worse, not better. And third, Mr. Chairman, the United States Senate is not doing its job. Healthcare. Citizens of the United States, our employers, our taxpayers, and our families pay the most and get the least. That has been persistent and chronic, and it's not being addressed, it's being aggravated. Let me be specific. In Vermont, a family of 4 that makes $82,000 in income with premium support on Obamacare now pays $6,970 for their health care premium. That is going to increase $23,000 to $30,000. That is unaffordable, it's shocking, and it's cruel. The big beautiful bill that we're talking about, Vermonters are going to lose 45,000 families lose health care. that is going to be a hammer blow to our hospitals, because those folks who lose health care don't get a guarantee they won't get sick, and they're going to show up at our community hospitals. Our community hospitals are going to treat them, and they aren't going to be compensated. And it's why Vermont community hospitals are on a financial thin ice, and that's true that about 338 hospitals around our country are in danger of closing. Second, Mr. Chairman, I believe the Secretary made assurances to this committee, and he has not kept the promises he made. Prices have not come down, they've gone up. He assured Senator Cassidy that he would not change the standards for vaccine review. Yet since his confirmation, all 17 members of the Vaccine Advisory Board have been fired by him. He has limited the use of COVID-19 vaccine, and he has inexplicably canceled $500 million in vaccine research and funding. So, you know, I'm not surprised. Stephen Miller credited you with being the crown jewel of the cabinet. And my observation about the crown jewel of the cabinet and the policies of the folks who get rewarded are the ones who fire those in service that speak truth to power. Susan Menares, we've gone over that, fired because she refused to fire herself, staff without cause, and refused to rubber stamp changes to the vaccine schedule without data. The head of the Bureau of Labor Statistics was fired because she gave a report with honest numbers about the job report. CIA Russia expert who'd been there for 30 years, fired after the meeting with Putin. So, Mr. President, that is serious and worrisome. But I want to finally end by challenging us in the United States Senate to do our job. We have a constitutional responsibility to be a check and balance. And the fear of our founders was that there would be a concentration of power in one branch, and that would lead to catastrophic consequences for our country. And what has Congress done? On oversight and advice and consent, we have confirmed a vaccine denier. On tariffs, we've given up our constitutional responsibility. On appropriations, we're bending the knee to an administration that is rescinding and decided what to spend and what not to spend, despite what our law in a bipartisan way was passed. We cannot cede power, and there are consequences. A crumbling healthcare system, a deficit exploding, and our allies losing faith in us. You know, Mr. Secretary, in the past, you have accused some of my colleagues of being in the pocket of pharma shills. You did that with Senator Warren today. You've done it in the past with Senator Bennett and Senator Sanders. You are not a pharma shill. But I believe we have to fight pharma and bring down the prices. And Senator Cortez Masto spoke about the legislation that we now have that would reverse the $5 billion handout to Big Pharma in the One Big Beautiful Bill. And when I leave today with Senator Wyden, we are going to go to the floor and seek unanimous consent to pass our legislation that would reverse that giveaway. And I ask you to put your policy in your body where your mouth is and join us in supporting that bill to restore price negotiation power so those pharma prices can come down from being the highest in the world to something within range of reason. Mr. Chairman, I yield back.
Thank you very much. Senator Young.
Welcome to the committee, Mr. Secretary. It's my intention not to raise my voice and to give you an opportunity to respond to an inquiry. I'm going to begin with long COVID. Shouldn't be surprised to you. During each of our meetings, we've discussed my interest in making sure our government does its part to address this challenge, which afflicts, by most recent estimates, over 20 million Americans. They have been diagnosed. There are a number of others we know that go undiagnosed. Over 400 million people worldwide suffer from this at a cost of $1 trillion a year, which is roughly 1% of global GDP. This, we know, has had impacts on participation in the workforce, therefore our own GDP. So it's serious on a number of fronts. It's my hope we can come up with some therapeutics for this condition. One of the real barriers to that is seeing that we are able to launch more clinical trials. I want to get your update on how the clinical trials are going, what plans you might have in the works to increase the number of clinical trials as it pertains to long COVID.
Yeah, Senator, there was a project funded, a long COVID project at NIH. There was a huge amount of money spent on it. It yielded nothing.
I agree with that.
Right, and I think you know that we are doing now a different approach. We're launching a long COVID consortium. We're bringing together the best doctors in the country who have developed reputations for being able to treat long COVID. And one of them is a doctor that actually...
Dr. Bruce Patterson.
Yeah, Bruce
Yes.
Patterson, and then Dr. Jordan Vaughn, also from Florida. There's a number of them who are doing spectacular things where patients are reporting extraordinary progress. We want to get them all involved, all in one room. We want to identify the protocols that are working. This is something that did not happen during COVID. It was all ivory tower science, and the doctors who are on the ground were ignored. The same thing happened during the HIV crisis.
Yes.
And we're trying to do something different, which
So
is
my
really
time's limited. You mentioned ivory tower. And so that's a segue into a statistic that I've become familiar with over the years. It takes roughly 18 years for proven interventions, pharmacological or other types of medical interventions, to make their way out into the field. If we assume, I think a conservative estimate, 12 to 15 years until we have any really acceptable therapeutics for a long COVID, that's a cheerful estimate. Plus the 18 years until it finds its way into clinical practice, people roughly my age will pass. Actuarially speaking, they will pass before there's any acceptable therapeutics. So we need to accelerate our current activities. Can you give me a couple of things you're going to do to ensure that we accelerate our development of therapeutics?
I mean, the best solution is the same kind of solutions that we should have been pursuing during COVID, which is off-the-shelf approved drugs for that are there already.
Yes.
So you don't have
It was
to go
recently
through a
reported that all the major pharma companies, I'm sorry if there's one good student exception, are serving as barriers to clinical trials. That is,
It's
how can they
bizarre.
repurpose?
It is bizarre that that's happening.
Okay,
We
you're
are
the
seeing that
Secretary of
happening.
HHS. Will you be cracking down on this lack of
Yes,
cooperation?
yes.
Thank you.
Yes.
Thank you so much. Will you also be exploring research partnerships with other countries, seeing as I've established this is a global challenge?
Yes.
Okay.
And that's what we should have done during HIV. It's what we should have done during COVID.
Yes. Will you also be exploring whether ARPA-H, which has different research of protocols than NIH, NIH is very good at what they do, but it takes them a really long time to prove things because of their rigorous process. ARPA is more practical, right? And so one could imagine ARPA-H tackling this challenge. Will you be encouraging
We're
this?
absolutely open to that, Senator.
Okay. Will you be working with me and other members of the committee on your aggressive strategy as it continues
Yeah,
to
and
be
looking for good
articulated?
ideas everywhere.
Okay. The last thing I'd like to briefly touch on with the chairman's indulgence is just recognizing the president's leadership as it relates to the appropriate use of civil commitment to deal with homelessness challenges, mental health challenges, et cetera. He's taking a look at these practices. This can be a difficult conversation for so many of us, but I think it is worth considering whether government can play a more assertive role in helping people off the streets who have serious mental illness get off the streets, receive the sort of treatment they really need to be healthy, Can you provide some very brief thoughts on this topic, and maybe then I could follow up with a phone call?
On the topic of,
Civil commitment.
it's
We can follow up,
it's
Mr.
mainly
Secretary.
happening in the States, so I want to hear your ideas on it, if there's something that you think.
Yeah, I
we
think,
should be doing.
I think the president said, you know, we ought to take a look at it. If there's somebody in 20-degree below zero
Yeah.
temperatures consistently in Washington, D.C., and they're believed to perhaps have mental health challenges, might we consider how to offer them care in
Yeah, and you know,
a
there's
controlled setting rather than allowing them to freeze to death? Might that be
Yeah.
humane as we
Well,
reconsider
perhaps the two of
application of
you
our
could
laws?
follow up on that with each
Yeah.
All right,
And, Mr. Secretary, you've been here just like a minute or so under 3 hours. We appreciate that. We're not quite done yet. Senator Wyden has asked for one more round, so I said he, as the ranking member, should have the right to have one more round of 5 minutes for himself. And so Senator Wyden, why don't you go ahead?
Mr. Secretary, we'll keep this brief. I want to ask about mifepristone. I was the first member of Congress to hold a hearing on this drug, which now has served more than 7.5 million women. And of course, it is used for reproductive health and medication abortion. It has been documented again and again as safe, and people say safer than Tylenol. And the reason that I'm asking the question is that I'm getting reports that you've said you're going to conduct a complete review of mifepristone's safety, and what we're hearing is it's not based on new clinical trials or data from the scientific community, but on one reviewed paper that's not a peer-reviewed paper by a political organization and Project 2025 sponsor whose stated mission is to advance an anti-abortion agenda. So what I'd like to hear today is for you to say that you'll commit that your best scientists, without bias, will be permitted to conduct this entirely unnecessary safety review. I don't see any evidence for it. You've called for it. But what I'd like to do is make sure that it's done right, and I'm very troubled by what I've heard about it. Your thoughts?
you have my commitment.
Okay.
That'll
Yeah.
be good science and good scientists.
Okay. We'll get back to you to talk about specifically how that's going to play out, but I appreciate that. Okay, one last point for you, Mr. Chairman. I'm going to ask unanimous consent to enter into the record declaration by these kids, you know, some of them very young, who in the middle of the night, we were told by whistleblowers, are being whisked away and the like. And what I'd like to enter into the record are statements by these kids that we have learned about, and also a memo prepared by the Guatemalan government outlining the deportation effort into the record. We've been able to obtain that, and I think it's an important part of the debate. And with that, I beat my time of 5 minutes.
All right, without objection. Thank you very much, Senator Wyden. And we are now at the point where I'll just make a couple of very brief personal closing remarks, and then I've decided, Mr. Secretary, you know, I said at the outset of this hearing it was going to be some partisan battling going on. That is something that is very obvious to anybody who's paid any attention to what's happened in the last 3 hours. There were several times that you were cut off, or I had to cut you off because we needed to keep moving along. And I'm not suggesting that you need to or should, but if there's anything that you felt you didn't have a chance to say, if you could briefly say it now, or if you would like, you'll have the opportunity to submit written responses to questions, which I'm going to reference in a minute, and you could make any further statements that you would like to make at that point. But
I think I'll have mercy on everybody here and let us adjourn.
all right, wise choice. Let me just say now that senators will be allowed to submit questions to you for the record by next Thursday, September 11th, by 5 p.m. And I just want to say, Mr. Secretary, during former Secretary Becerra's tenure, Responses to these kinds of questions, for the record, were not delivered in a timely manner. And the example I'm going to give you is that on March 22, 2023, he got questions. He answered in February 22, 2024, 11 months later. A year seems excessive. And I'm going to ask you and your team to not follow the precedent set by Secretary Becerra, and instead to respond as promptly as you can to the questions for the record that you receive. I ask that of every single nominee, and you may or may not recall, you've probably already told me you would do that in your nomination hearing. But with that, once again, to my colleagues, the deadline for submitting these questions for the record is September 11th at 5 p.m. And hearing nothing further, this hearing is adjourned.